Hi everyone, thank you for joining us here at Indian River County's County Administration Building for our May 29th, 2020 update on the local response to COVID-19. Today you'll hear from County Administrator Jason Brown, County Health Administrator Miranda Hawker, and Corey Richter, who will provide an update on the hospitals. After the presentations, we will take questions. Jason?
All right, thanks, Brian. Good afternoon. As Indian River County continues our phased and strategic approach to safely reopen county facilities, we are pleased to announce today the ability to schedule appointments with county staff by using the new appointment scheduler on the county website. The appointment scheduler will allow county staff to offer services like building permits, utility transactions, and planning questions to county residents and businesses while ensuring all social distancing guidelines are followed. For more information on this, you can visit the county website at ircgov.com. That will be live, and appointments will be available beginning Monday, June 1st. So we will continue to provide those services online and over the phone, through the drive-through, if you will, but we are excited to offer this additional opportunity for those in-person transactions on a limited basis in a socially distanced manner. Also, the Veteran Service Office will be seeing clients in the office by appointment only beginning on Monday as well. Appointments can be made during normal business hours from 8:30 to 5, and to take advantage of these services, please call Veteran Services at 772-226-1499. That's 226-1499. Also, the Indian River County Libraries, Main Library, North County, and Brackett will also begin opening to the public for 1-hour computer appointments for essential business and printing and copying. To make an appointment, please contact the reference desk for the library that you wish to visit. The front door hold and pickups at the 3 libraries will continue for those wanting to check out those books, and of course our online and ebook services continue as well. As we continue to progress through our thoughtful approach to reopening our community and businesses begin opening and others adapt to serve more customers, we must remember that we need to continue participating in those efforts to fight against COVID-19. We will remain committed to responsibly reopen our economy while taking those appropriate steps to protect the well-being of our residents and visitors. While COVID-19 has been a new challenge for Indian River County, our community is well aware of the potential challenge posed by hurricane season. Remember to be prepared while also taking advantage of the sales tax savings holiday, which begins today and runs through June 4th. During this time, sales tax is waived on things like batteries, flashlights, generators, and other items that will come in handy in the event a hurricane impacts our community. Additionally, remember to sign up for the Indian River County Alert System by visiting alertindianriver.com, and you can get those text messages, emails, and phone messages for all things COVID-related and emergencies such as hurricanes. So for more information on the county services, facility hours, and helpful links related to our response to COVID-19, please visit the website at ircgov.com and follow us on Facebook at IRCGOV. Thank you. Now I will turn it over to Miranda Hawker.
Thank you so much, Jason and Brian. So statewide, as of 11 o'clock, we had 54,997 cases with 9,982 hospitalized and 2,413 deaths. Our current number of cases is at 122, with 10 cases reported this week. In the last 2 weeks, we've increased by 18 cases. So May 1st through May 15th, we had 12 cases. And in these last 2 weeks, so the 16th through the 29th, we've had 18 cases. And I'll talk about what my concern is about that. I'll just go into that at this point, is that as we have opened things up, I am concerned that as people want to get back to whatever this new normal is, that we all fall back into our old patterns. We want people to keep those good public health patterns. We want you to continue to use masks in public. We want you to continue to wash your hands and perform hand hygiene frequently. We want you to continue the social distancing. All of those things are going to keep our community safe, and we need to continue to do that. For the Florida residents, there are 29 people with a history of hospitalization. The age range of our cases is from 5 to 95, 57 men and 55 women. We have had 9 deaths. There were no new deaths reported this week, and that is very, very positive. In terms of race and ethnicity for Florida resident cases, we've had 111 for Florida resident cases. 9 of our cases are black, 76 are white, 16 are classified as other, and 10 are unknown. For ethnicity, 8 individuals are Hispanic and 81 are non-Hispanic. 10 are unknown, to where we have no data on those cases for ethnicity. We have had 20 cases in long-term care and staff, and that's an increase of 1 over last week. The health department continues to provide public health support to our vulnerable populations in long-term care facilities. We began our community testing in Wabasso this week in partnership with Fire Rescue, and we tested 27 Wabasso residents. And that was testing that was focused on that community and open to those community residents. We got that word out through the community leaders and the pastors in that area that we were very, very happy with how that went. We'll continue to work to get into Fellsmere and Gifford in coming weeks and expand that work in testing our vulnerable communities. CDC recommends wearing a cloth face covering in public settings where those social distancing measures are difficult to maintain. When you see that we've increased in these last 2 weeks from 12 to 18, that's something that I really want people to be mindful of. If you have COVID-19, even if you don't have symptoms, cloth face coverings help prevent you spreading the virus to others. So my cloth face covering protects you, and your cloth face covering protects me. So it really underscores the fact that we're all in this together. And even if you're wearing a cloth face covering, you have to make sure you maintain that social distancing of 6 feet. Jason had his stick that we had in a previous press conference, and when we brought that, Jason, I'm sure it's around here somewhere, it really reminds people just how big that 6 feet is. We really want you, as you go out in the community, still to limit your risk by taking steps to reduce the number of places you go and your exposure to other people. The health department will reopen its lobby on Tuesday. Anyone entering the health department will be screened for temperature and symptoms at the main clinic entrance. This entrance will be the only public entrance. Our services will continue as they have by appointment, online, and telephone, much in the same way of the county's services. WIC is continuing their services by telephone appointments. Vital Statistics and Environmental Health will schedule services in the office by appointment. And individuals are encouraged to use the online and fax services available. If you are picking up or dropping off paperwork at our individual departments, you'll be screened before entering the facility. We strongly encourage visitors to the health department to wear a cloth face covering to protect each other. Testing is available through the Cleveland Clinic and Indian River Hospital drive-through testing site and the health department. The health department is doing homebound testing in partnership with the Visiting Nurses Association. Anyone requesting this assistance should call 772-794-7411 if they require this resource. Individuals who are homebound are those who are unable to leave their house due to illness or advanced age. The health department has done 328 tests, and currently we have the capacity to perform 1,547 tests. This week, since last week's press conference, we tested 149 people. Total tests done in Indian River County are 5,454 with 122 positive, 5,332 negative, 56 are pending. I want to talk a little bit about the testing. So as we increase in our testing, what we look for in terms of public health is that positivity rate. So what percentage of our tests coming back, what percentage positive are they? That gives us a measure for how severe the outbreak is in our community, and that is a barometer that we look at. Over time, we've fluctuated really between that 2 and 3%. Currently, as a percentage of our total tests, we're at 2%. And that's all I have. I'd like to turn things over to Corey Richter.
Thank you, Miranda. To date, both hospitals again are gearing up, and actually the Press Journal had a article about the elective surgeries. They're doing a little bit more elective surgeries now. They're not at 100%, but they're gearing up. But they're still. I just want to reassure everybody that they are gearing up with the elective surgeries, but they are still in a mode of they can fluctuate if they need to, if the COVID virus gets a better hold, well, not a better hold, a bad hold into the county, and numbers start going up. They're still prepared to treat the patients and see you, and they don't want people not going to the ER. Be rest assured that everybody's screened before they come into the ER. They are then set into a different avenue than the regular patients if they don't have signs and symptoms of COVID. So they do keep them separate, and they do keep them safe. Just want to make sure everybody understands that, and don't not call 911 or go to the hospital if you have a medical emergency just because you're afraid that you may catch COVID there. Now with that, I'll talk about some of the numbers. Cleveland Clinic, their total numbers to their hotline to date, it's 7,273 calls they've taken so far. That hotline, again, is 226-4846. It's open 9 to 5, Monday through Friday. Now, no Saturdays or Sundays anymore with that. As far as their testing numbers, they've tested 4,613 total tests that they've done in their drive-through. Out of that, 4,448 have been negative, and they have 82 pending and 83 positive. So it's a little jump from last week of about 6, I think it is, from what I had reported last week. So they had 6 of the 18 that were found in the county. They only have 3 in-house. That number stayed the same from last week. So the people sick is down, which is good. But we still need to do the social distancing, like Miranda said, and wear the mask when you're out in public, because you're helping protect other people. You could still have the virus, not know it, not be having symptoms, and spreading it. So the mask helps everybody else. And Sebastian River Medical Center, they're testing. They've done 107 tests total. 98 have been negative. They only have 1 pending, and they're still at 8 positive. So they've held at 8, but they've only done a few. Obviously, Cleveland Clinic, with their drive-through, they do a lot more testing than Sebastian. Sebastian it's just the numbers that come in through their ER. So with that, nothing else, unless there's any questions for anyone.
Yeah, I've got some questions, probably for Miranda. So it sounds like the numbers are pretty good. What do you attribute that?
Well, that's a hard question. I do think that everyone did a really good job of staying home and social distancing. I think that we are also further away from, the areas where we have a greater amount of transmission, like the outbreaks that are occurring down south. I think it's hard for me to speculate, Larry, on that amount. But what I can tell you is that it's important that we continue the good habits that we've had. And when I've gone out in the public, with wearing my mask, of course, when I've gone out in the public, I'm seeing less people in masks. I'm seeing less people being mindful of their social distancing. And we're all creatures of habit. I want people to try to adjust to a new normal. I mean, for the most part, just me personally, I've adjusted to a new normal, and I have a perimeter of about 6 feet. But all of us fail at that sometimes. So it's important that as much as each of you that are here to get that word out for people to maintain their social distancing, we want to focus on that.
When we look at the percentage of people in the community that have been tested, it sounds like you're doing some more outreach.
Mm-hmm.
What is that percentage of people that, the percentage of the population that you want tested? Do you have a target over time, or?
So the state surgeon general established a target of 2% of the population each month, and we met that target last month. I believe we were at 2.17%. I'll have to double check that statistic, as did our surrounding counties. And so he set that goal again for the month of June. So we're going to be working to do that testing and increase. We've increased our testing both at our health department. Cleveland Clinic has continued to do testing at their facility, and they've been an amazing partner. I can tell you Treasure Coast Community Health is also working to increase their testing. So we've coordinated with them. And there are other facilities, doctors' offices out there doing testing. So I'm really excited about this partnership that we have with Fire Rescue, that we are working in tandem with Chief Stone to increase our testing countywide. You're welcome. You can know the it's hard to understand the testing numbers. And what we also look at, when you look at counties like Martin and you look at counties like St. Lucie, they have a higher number of people that are hospitalized. And so if our testing numbers, if we were thinking that our testing numbers weren't really indicating the severity of the disease in our community, we also can look at the hospitalization rate as an indicator of the severity of that outbreak in the community, if that makes sense. But certainly the department overall and statewide, and we share that view, we want to increase our testing within the county, and that's something that we're definitely working towards.
Okay. It looks like Brevard's got sort of lower numbers too, from a percentage standpoint in their population.
Mm-hmm.
As well. Does that get back, do you think that gets back to the whole proximity of where we are from, say, South Florida?
Well, I really can't speculate. I do keep in touch with my counterpart for the health officer up there, but I really can't speculate as to that. I do know that there are an awful lot of people that congregated in certain areas for the launch that happened just a few days ago. So that's a situation where we continue to want to encourage the public to socially distance. Thanks.
Thank you, everybody, for joining us this afternoon. We will send out an update early next week about whether we'll be having another press conference next Friday. Have a wonderful weekend.